Hey guys, Dr. Andrew here, and let's get this health. Today I wanted to talk about scoliosis. Now, scoliosis is a lateral curvature of the spine over 10 degrees. Now, this lateral curvature has been shown to take on average 12 to 16 years off of somebody's life. And to put that in comparison to something like diabetes, which is known to take 10 to 14 years off of somebody's lives. Now, why does it decrease lifespan? Well, because the organs are being, now the nerves here on that side, they're being pinched, and they could be going to our heart, to our lungs. So it's affecting the way that the brain and the rest of the body interfaces, which we know is essential for health. Now, scoliosis affects 3 women to every 1 man, which means that more women have scoliosis than men do. Now, there's a variety of different causes of scoliosis, but it's usually seen around the teenage time frame. Now, this is due to when growth cycle takes place, but it can be observed in infants as well. Now, let's go over how scoliosis is normally diagnosed within this country. Now, if we go back to middle school, elementary school maybe, we can remember going to the nurse's office and we would do something called an Adams test. Now, this test, we would lean over and the nurse would tell us if we had scoliosis or we didn't. Well, the overwhelming majority of us were told that we didn't. But we could have had a scoliosis there and we would not have known about it. Why? Well, the Adams test is also called the too late test. So you have a curve of 10 degrees here. You could lean over and it would not show up as a positive on the Adams test. The curve has to be over 20 degrees in order for you to see it on an Adams test. Now, what does that mean? It means that we need to catch scoliosis at an earlier time frame. So that could be making sure that children get their spinal x-rays, just like you would go to the dentist to have an x-ray done for cavities. Have children get x-rayed to make sure that they're not developing subluxation or scoliosis. Now, once scoliosis is found by the medical system, their typical course of treatment follows this. First, they're going to observe. They're going to see if it progresses. Once it progresses, they then want to do surgery on it. Now, the surgery is shown to be ineffective and it's pretty brutal because what happens is you have a curve that's curved like this. They're going to put a steel rod down these here. They're going to rotate, twist, and lock you in that position there. After that, you've lost motion in the spine and you could just go back to the typical subluxation pattern you already had. Now, first of all, if we identify scoliosis earlier, it's going to be easier to treat. Now, as a chiropractor, the first thing we're going to do is we have to have goals set. Our goal is, first of all, to stop the progression. We're not going to just wait to see if it progresses or not. We're going to go through adjustments and a rehab protocol to make sure that scoliosis, it's an advanced form of subluxation, does not progress to something worse. After that, we want to also make sure that it maintains that level. Now, this is our maintenance, our wellness level adjustments there. Also, we could possibly get we could also possibly decrease the scoliosis. Now, the only way to get this checked out is, first of all, make sure you get here earlier. Now, knowing that something can take 12 to 16 years off of somebody's lives that is easily treatable, wouldn't you want to get them checked early? Absolutely, I know you would. So we need to make sure, first of all, that we get an x-ray done. Now, the scoliosis, as I said prior, is just an advanced subluxation. So we need to make sure there's no subluxations in the spine and also there's no scoliosis forming. After that, we need to create a treatment protocol to make sure we stop the progression and that we also can get some correction in there and have you living as close to your optimal life as possible, because if there's subluxation there, it's not happening. I love you guys and I'll see you guys soon.